want to welcome everybody to the Her Health Unveiled. We're talking about global voices. We're going to bring up Miss S. Lewis Campbell. She resides in London, England, so she's a little bit ahead of us in time, but she is coming to us to talk to us from an international perspective about women's health. So I want to bring her to the stage right away because I feel what she's bringing to us is so important in today's world internationally. So, S. Lewis Campbell, would you like to introduce yourself?
Yes, certainly. Thanks for having me, Grant. I'm Shara Lewis Campbell. What you're seeing there is S. Lewis Campbell is actually my author's name. I'm fortunate to have 16, I think, publications under my belt, so I've stopped counting quite some time ago. I'm also the proud owner and founder of Re-Ink Publications as well. And formerly, prior to that, we were known as Beauty and the Beast Publishing. So yes, that's me. And what else can I tell you about me? Oh, and also in terms of this particular series, how I can really sort of resonate with what we're doing is that in my spare time, should I say, I'm very interested in healthcare. And prior to being this business owner and doing this great work within the literary space, I worked for just under a decade as a senior executive assistant for various organisations in the UK here. So ranging from the National Health, which is the largest non-profit medical organisation you can have in the UK, and including their regulators, which is the National Health Service England, or NHS England, as people like to call them. I've also worked for some specialist organisations as well, being BCS, which is also known as the British Cardiovascular Service, as well as others. So I won't go into all the others, but that's me in a nutshell, roughly.
No, that is
Pleased to be
wonderful.
here.
Thanks for sharing all the accolades, and it gives the voice of credibility of what we're talking about. Now, me and you got into a conversation. We've been working together here for a little bit of time. And then you came to me with this idea around Her Health Unveiled. And we're talking about on a global scale because it is so important to understand women's health and what is going on across the, not only in London, England, United States, but all across the actual world. This will be a six-part mini series. So this will be session one. And we're going to have conversation. We want to encourage the audience to give their comments, how they feel about these things, because it's so important. So, Shara, I want to ask you this. And you're based in London. And as you work across communities, how would you describe the current global state of reproductive health? And what regions are making progress? And where do you feel maybe they're falling behind?
Well, first and foremost, I think it's really important that we're having this kind of discussion. Female maternal care as well as reproductive care is really vital, for all women, around the world, just period. Um, and it's what I've seen in terms of the research that I've been doing is that, as we've seen recently, with certain law changes in the US, which was first seen as used to be seen as like pioneering, medical institution and fraternity all around, as a global inspiration for others to follow, and for various specialist surgery that we've seen in that field take a very much a back step and quite a regressive step, as we've seen, with the recent abortion laws, which is quite a sensitive subject, as we're seeing. And we're seeing whereas in the past, other countries like Africa and Asia were considered quite behind the times, are leaping forward in ways and bounds that we've seen unheard of. The investment that they're putting into reproductive health and education and information and so forth, and even free healthcare as well, in these parts, is just quite surprising and really, really inspiring and optimistic, to see better health, especially in these areas for women globally.
This is important because I think depending on where you're at, where you're situated at in the world, you have a perception of how healthcare should be delivered, or maybe potentially your place in the healthcare ecosystem. I know a lot of people have been talking about this. The United States is not, what you call, not even in the top 10, not even in the top 20, not even in the top 30 for healthcare delivery for a number of different reasons. And we want to get a handle around that because you're in a whole different world. You have a whole different health system that you work with. So when we often talk about reproductive rights in the United States, we're talking about, major legal and systemic challenges faced by women that potentially could be in Europe, Africa, and the Caribbean, but they all have something that they're dealing with. Are there other legal and systemic challenges faced in other parts of the world outside of the United States, or are they similar to what we see in the US, in your opinion?
I think that the way that the medical sector is moving forward, especially with the introduction of the digital tech, and AI and so forth, I think that that's definitely progressing. However, I do think that we need to really look at the infrastructure of our NHS service currently. We say it's a free service, but it never has been if we've been paying into it all these years. So you can go there and get access to care that, straight away. However, it is being invested in, by the taxpayer. So I don't think that that's something that should be ignored. It's just as important as the private healthcare that's being offered. And having been a patient of both, I can say that there isn't much difference. It's the same doctor you're seeing. You're just paying one and not paying out of your pocket at that time the other, although it's coming out in your salary, every month, or your contribution, towards it. So I do think that there needs to be a lot of change within that structure. I think there is an argument for the life of the current NHS system that we have here is the life of it is very much being sucked out of it because of the changes that we've seen. Over the years, and especially since the 2000s, there's been lots of change, especially in terms of restructures, across most hospitals. We've also seen as well departmental changes. Um, and I've experienced that, so firsthand. So I know exactly what that's like. But I do think that there is definitely critical change that needs to happen there.
I think so. I mean, and we've prefaced this on women's health. There are certain disparities I wasn't even aware of. As a male, as a man, I just, you don't know all the things that go into women's health, which is a whole different, physiological type of endeavor. I didn't know, like, until 1993 that there weren't clinical trials in the U.S. for women, which I was like, wow, 1993, that's fairly recently. So a lot of the medications, a lot of the procedures and process and whatnot were male centric in what they were trying to deliver. And then as women, you had to just, go through that process themselves, which is, I just find that a disconnect on a lot of different areas. So these are things that I'm learning as a male about women's health that I just didn't know. Now we get into other areas of what, on a global scale. Everyone, I see in a lot of these countries, it's not just the United States, talking about immigration, they're talking about race, they're talking about ethnicity, and they all intersect with reproductive healthcare access. So when we talk about reproductive healthcare access in the UK and other Western countries, how do these issues play into that?
Just going back briefly to the comment that you've just made, I mean, you're quite right, and I completely agree with you there, and also just to add to that, we've only just seen very recently, that females are now being tested for autism and ADHD, whereas before, women weren't even being considered for autism, if it's a thing, so, we've come on leaps and bounds since then. Prior to that, people were just doing guesswork and self, diagnosis, so we have come on, leaps and bounds. In terms of reproductive care, especially within the diaspora, there is a lot more work being done, and it's really pleasing to see. And quite surprising to see how far we've come, from the 80s to where we are today. And, I even think as well that some of the work that they're doing is quite pioneering, that, Western countries need to actually take note, and see the developments and the improvements that has happened, there. However, there is still the shortfall, there is still hit and miss, like we've seen, especially recently in the USA. These changes, with the maternal care and reproductive care means that a lot of Black females within those certain states will be denied access, to reproductive health care, and may not have the facilities or funds or even availability to have access. So they'll have to think about going to other states, or if there's ways around that, and being treated elsewhere. And I think that that's quite regressive and has set us back quite a bit. So we need to improve on sharing our stories and having more open discussion about these things. By doing so, that will help us to advocate and make the change that we need to see.
I think that's so important. All of these things are so important. I know I've been moved by in the United States, especially when it comes to Black American women. Our maternal rates are just ridiculously low as far as mortality, that we're
Mhm.
losing a lot of our children through childbirth. And none of the other, when you start looking at the numbers from ethnicity and things like that, maybe location, regional or national, but the numbers are just really low. I'm just wondering, just curious, is that the same across the world, or are you seeing those same kind of numbers, or that's only in the U.S.? We're talking about Nigeria, Jamaica, Latin America. There's all kinds of different innovations, but is this a maternal crisis for Black people?
I think so, in some respects, I don't think that I'm the best qualified person to state that that is definitely what I've seen in terms of the research that I've done and continue to do. But I do think it's an ongoing conversation. I do feel that the stigma, and reputation, and as we've seen quite recently, someone's mentioned there in the comments about what we've seen, the sad changes that we've seen recently in the US, and
Yeah.
there's a case this week, about um, skeptical maternal care that's been received, by some, Black females, within the states at the moment, and we're seeing how that plays out in front of us and how that affects families, overall. And I feel that the conversation regarding female or Black female healthcare needs to be a stronger one. We have still got that stigma that it's not important, and that we don't have maternal care issues, such as fibroids, hysterectomy, etc., and those issues. And they're just as common and as profound sometimes in some of those communities.
Man, well, you're hearing from some people in the U.S. right now about the value of women in healthcare. I don't know why this is. Since 70% of healthcare in the United States is performed by women, right? So you would think that it would be a better outcome. But if you go back to that earlier statement I said earlier, that the actual processes and policies and procedures were done without women really being a part or at the table of some of this, these decisions. So when you start talking about experience and how cultural taboos just around menstruation or fertility or contraception that are impacting women and girls and in different communities, whether they're immigrant or refugees or in the Europe or the UK. How do you think all this, as you start looking at this, if we are inexperienced in understanding the women from a women's perspective, what healthcare looks like, and then we're not practicing these things, there's a disconnect. What's your answer around that?
I agree. We need to be listened more. So we need to challenge and we need to really demand, better healthcare. We need it. I can only say as well, we need to speak up more. I hear Too many horror stories more than I hear positive ones. And I know that there are positive stories out there, but they're not happening often enough. When I was working within healthcare and behind the scenes, the focus was more about near misses and what went wrong and what we need to do in order to ensure that that never happens again. It was terrible to see. And it's still unfortunate that with every procedure, there is 1 in 10, or depending on what surgery it is or procedure that's being performed, where it's going to go wrong. We want to make improvements on that. I don't think anybody's used the healthcare system as much as I have this year. If it's not been a suspected stroke, it's been vertigo. And, in terms of the vertigo that I suffered that for almost 4 months, when my and still having all these demands, within the workplace and keeping the business going, and things like that. We need better understanding. These policy makers need to understand, the requirements that females need within healthcare, because obviously it differs from men, and we need those policymakers, to open their ears and pay better attention, to what these requirements are, that we can feel better supported, because unfortunately, without the female, there's no life. We need to really look into that, and give it the most optimum importance where possible.
I think you it's so important, and I say this because I'm coming from the male perspective. You don't really think about it because it's not affecting you directly, so you don't think about it, right? When you're designing a building, you're designing an office outlet, you're designing a healthcare facility, whether it may be, you're designing it kind of from your own experience. You're not really taking into account everything that's it's very important. So when you start looking at research, for example, like I think there's huge gaps in data, especially when it comes to things like endometriosis, menopause, maternal mental health, let's say, especially for women of color. I want to understand, why is global research still lagging behind, and what, in your opinion, needs to change?
There needs to be some greater unity between these departments, between the patient, the family structure and the support there. There needs to be greater understanding as well within the workplace. We've seen how stressful life is, but the workplace hasn't changed to kind of accommodate that. So whilst people are feeling unwell, they're not being supported. A lot of people are not even being believed. When I was ill, you couldn't tell that I was unwell, but I was feeling as poorly as I could as possible. But there was still that focus on showing up, being able to deliver, and things like that. When outside of that, I was feeling like it was almost impossible. But because I didn't feel supportive, even when I was suffering with the vertigo, I had to find my own homeopathic remedy. And thankfully, my business partner was the hero in that situation, because the the exercises that I was being given to do were making me feel vastly worse, at the time. So there needs to be greater understanding, and patience, and just being listened to. There needs to be more advocacy as well, and people sharing their stories more, especially from the diaspora. And I think if we do more of that, then we can make those demands and put that pressure on the departments that need to help to enforce, the improvements that we need to see.
I think that's what's important, input, right? And understanding, like making sure that our healthcare systems truly understand the situations. Because if you're solving the wrong problem, you only started solving a portion of the problem, right? And not
Yeah.
all of it. And you haven't taken into account everyone's perspective as much as you can, especially when it comes to the clinical trials. Clinical trials is still an ongoing problem because a lot of people just don't participate in them. So then you take people that are participating in them, and then you develop medications, policies, and procedures from that. But because we've had such I call it colonial dominated society for a long time, and a lot of times, if you look at colonial history, you're going to find out a lot of people felt that they were just not a part of that decision making model at all. So you're just saying you're hoping and praying that sometimes some of these medications or whatever it may be will work for you. Same time, almost what you just said, you might go to a homeopathic medication, like, you know what, I'm going to start doing some things outside of this because this is not working. I'm starting to see more and more information. Things are coming out. People are just like, you know what, works for diabetes for people of color because the diabetes medications that came out for people that were of the Caucasian persuasion, that was made for them, and this does not work for me and my physiology. This is important to understand. So I want to understand when it comes to the role of faith, when it comes to the role of tradition, and the role of colonial legacy, right, in shaping reproductive health norms in post-colonial countries and in the African diaspora communities. What do you feel? Is there a role for these type of things in these communities?
I believe so. I think that it's just going to take a lot more collaboration, and greater understanding. We also, as individuals, it's already been said, it's already happening. We need to take a greater accountability as well for our own healthcare. There just came a point, as I mentioned, when I was suffering with my own illness or vertigo. I'd never suffered it before. And I've only ever known of one family member who had suffered it. And I wish I had been more understanding of their situation at the time because they were going through it quite a bit. And I wish I had that remedy for them because they didn't have the cure either. It seems as if it's just reliant on these BPPV exercises that you're expected to do, and all of a sudden there's going to be a recovery, and it doesn't work for a certain type of vertigo, as it were, which is the one that I had, unfortunately. And to think, just for anybody who is suffering with it, which is the BPPV type, just try some ginger root, just boil it, and drink that. It was the answer to my prayers. And I tell you now, I never am without it within my home. Should I ever go through that again? It was such a debilitating time. I don't ever want to, ever have a repeat of that. So those are things that kind of stay with me, and I do think it's really about sharing these stories, sharing this information, that and there needs to be a greater understanding, from those people within the medical profession to have a greater understanding of our needs within the diaspora. And we need to see more doctors as well, performing, for our communities as well and standing up.
What you just brought up there is just the doctors. If it's a completely male dominated field when it comes to physicians, and then the process of becoming a physician these days, I can only speak from the United States, it's difficult. It's very, very difficult to do to get to the point. First, it's very expensive to be able to get there, and then if you are able to get to a point where you're actual practicing physician, you're limited in scope and field. You know,
Mm.
uh, uh, to be very honest, you walk into a facility and you're looking for the doctor. The image that you have in your head of the doctor typically is a white male. I mean, it's just that is, and when
Yes.
somebody shows up differently, then you're kind of wondering, is this greater service, the same service, or less than service? You start having these questions where you probably
Yeah.
wouldn't even question that. Now, the good factor is there's more transparency now in healthcare, meaning you can look up a doctor and see their record and kind of
Hmm.
see, uh, do they have a positive record, or maybe is this their specialty? Do they really know
Hmm.
these things? I remember there was a time, especially in the United States, when you went for different procedures, that you can now request a women doctor, where before you just got what you got. I feel that's kind of, when you think about that, it's like, wow, there's such an invasion of privacy. I mean, do you really want to go through something as personal as that with a male doctor as opposed to a female doctor? But then if you don't have that many female doctors in the first place, you're going to find yourself, having those kinds of experiences, right? So I like what you're
I
saying,
agree.
to get more partnerships. We need to, be intentional about getting more women into the field. So here's the question, like, so you look at London, you look at Lagos, you look at Lima, and all these cross-continental partnerships. Can they help build a more resilient healthcare system for women, in your opinion?
I think so. I think we've seen some great works, that's been, that we've seen coming out of Africa, for instance. We've seen greater sort of medical technology, in terms of improvements. We know we've seen a lot more testing in terms of cancer, and even COVID, and things of that nature. I think what's coming out of that country is quite unique within itself, what they're bringing out. And I think a lot more awareness, needs to be given as well for these areas, and the great healthcare, that they are showing is possible. So I do think that there's lots of great things to look forward, from Africa, and will continue, for the future. And I think more emphasis needs to be given to that as well. I think we're also still seeing a lot of corruption in the field, as well, where we've seen more recently in COVID, where just specialist companies were, being trialed for various medications, vaccinations, and medical equipment, even. And I think that scope needs to be, looked at as well and expanded upon. There needs to be more choice, like you say, in terms of medical surgeons and professionals, available at our disposal. And I think that there needs to be a lot more input and emphasis as well from the patient and their needs, as well. And that is, I find that sometimes that is quite limiting as well.
Yeah, we got to start listening more. We have so many more tools available. Our world has changed dramatically from a technological lens that we couldn't really see and talk to other people real time in other parts of the world, which we can now, and start to share different experiences. We can get to different results, whether it's mobile technology, we got AI or artificial intelligence, we've got a cloud computing fabric that we could all get involved in now and start to see these different nuances. We used this technology during the COVID age because COVID didn't affect just certain people. It affected everybody, right? Male, female, children, all kinds of ethnicity. It didn't really matter. And that's what disease does. It really is not discriminatory in that respect, right? But we have
Mm,
to understand these disease states operate differently in the physiological realms of different people. We can't just have different medications and that type of thing that were geared for just one type of of human experience, right? Depending if you're
mhm.
European or African or Asian or from the Latin community, we got to make sure that it's operating in all these different areas in different ways, and you have different. When we noticed that you have different medications depends because there's different thicknesses. It's not just it's because it's particular race. No, there's pigmentation. There's other factors that make up a person's genetic makeup, and those genetic makeups have to be taken into account when you're putting together medications that are going to affect the physiological makeup of that person. I think it's very important. We've only got another minute or two here. I want to give that time back to you. If you've got a final message for women or advocates or health leaders that are out there, especially those in countries that their voices don't go heard, meaning they really go unheard, I want you to be the voice of that voiceless. Can you leave us with a few
Oh,
thoughts, please?
thank you. Yeah, definitely. I think that we need to be having this discussion more, more discussions like this, I would like to see anyway. I think it's the only way that we're going to get improvement in the health sector, that we all need to see, especially for those sort of underserved communities as well. We need to be the voice for them, by us demanding change and us supporting our sisters, from the diaspora, etc. We'll be able to create better healthcare services for those as they come up. So it's more advocacy, it's more sharing those stories, and it's more demand for change.
This is important, and we're going to continue to have these stories. This is our This is part of a mini series. This is our first part of that first session. We're going to have 5 additional ones. I want to put onus back on our audience. You're listening in. You're hearing this, and you have an opinion. This is how we get better. Express yourself. Let us know what you want to hear about. What's important to you when it comes to women's health in today's systems, whether in the US, you're over in Europe, you're in other parts of the world. This is an open forum for discussion. And I am so glad we have such an accomplished person and Shara Lewis Campbell, who is an accomplished author. She says she's written so many books she can't even keep count any longer. But I really appreciate you taking the time to be here again. So we're gonna let everybody go. But before I do, would you like to say goodbye?
Yeah, thank you so much for having me, Grant, and thank you for this really, really important opportunity. Look forward to next week.
Yes, and we'll be here at the same time, Penny Rat. I know in the East Coast we're coming on at 2:30. Make sure that on Fridays we are live. So Fridays at 2:30. The next 5 weeks we will be here. You can listen to both Grant and Shara talk about women's health on a global level. Thank you very much. Bye bye.
Thank you.